guest today is
Miss OFOEGBU Rachel Oluchi. She's a graduate registered nurse and a certified occupational health nurse. She's a graduate of the University of Cape Coast, where she obtained a nursing degree. With a strong foundation in occupational health and safety, Oluchi has actively contributed to healthcare units by promoting proactive health measures. This is beautiful. Oluchi is a dedicated healthcare advocate who is passionate about promoting healthy lifestyles, preventive and corrective medicine. That's it. So, welcome, Miss Oluchi.
Mhm. This
Please,
is
can you introduce yourself?
okay. Good day, everyone. My name is Oluchi, popularly known as Einea. People call me Einea. That's fine. I'm a graduate registered nurse from the University of Cape Coast, where I obtained my diploma at the University of Port Harcourt. I have strong, solid years working experience, working with varieties of healthcare sector. I'm equally a certified English occupational health nurse, and I've worked around vast the healthcare industry where we have to promote healthy living, promoting preventive and corrective medicine. And today, I'm here with Inside Healthcare Podcast, where every voice really matters. Thank you.
So, let's just go into what's the business of the day. Um, there's this saying that if you fall sick, there's a possibility that the next person beside you so probably fall sick or anything. So now my concern is, why is it that most these days, because about two or three of my neighbors, they fell sick together, and it's something that I've been worried about. And I mean, so why is it that people just fall sick time to time, and when you fall sick, well, there's a higher chance of the person staying with you also fall sick too at the same time.
Yeah, actually, depending on the type of sickness that the person A is having, depending on if it's a airborne disease or a condition that the other person can get easily, it is possible for person B to get infected with those diseases. If it's like a communicable disease, let's say, or maybe it's usually by a client is having cough or having runny nose or having sneezing, or maybe in a case where a client is having something like pneumonia or respiratory distress, respiratory conditions, it's possible that the other party might get to experience it if the person doesn't um, deploy a medical treatment as soon as possible. And the one beautiful thing about it, we live in the same environment, we share the same air, we inhale the same oxygen, we exhale the same gas as well. So it's possible that party B might get to contact the infection as well. That's if party A doesn't treat the illness as soon as possible. The person doesn't go to the hospital or get treated, then party B or C or anybody around them might get infected with such disease condition. It's very possible. And that's how infections and disease condition tend to spread to people around the units or environment.
Okay, thank you, Miss Olushi. Now, welcome once again.
Mhm.
So, it's not really a big cost. Like, okay, this is what is causing it. It's just a daily factor that's okay. Probably me as the B part can, or how can you put it that okay? Is there a way I can avoid it, not to be contacted, even if it is possible that I can be contacted?
Okay, there are actually possible ways we can protect ourselves from being infected from these, airborne diseases or airborne medical conditions. The best way we can do it is to solicit, push party A to go to get medical treatment. The better we start to implement a preventive measures on the early start of the early stage of such infection, the better it is for us in the immediate environment. So if we are trying to, oh, this person is not feeling fine, we notice that this person is coughing profusely or having a respiratory distress or having a infection that can affect everybody in the immediate surrounding. Even if the person is feeling laxity or feeling complexant to go to the hospital, we can, as an individual, make it a duty to push the person. Oh, when are you going to the hospital? Even if the person is feeling reluctant, we push and motivate the person, giving the person reasons why the person has to go to the hospital, and get proper medical treatment. By that, we try to break the chain, the cycle of infection, and people around the surrounding getting infected with such diseases conditions. Now it's possible if we can work together to make the party A to go to the hospital as soon as possible.
Okay, thank you. So my question now is, we have party A, we have party B, right? So how fast should party A leave the house or go for a treatment to avoid party B contacting it? You know, sometimes you just feel like, oh, okay, it's just cough, it's just cold, it's just flu. There is nothing much. I can use my face mask. I can use. We all know that. For me personally, I feel like if the, you know, and there are some individuals that are very stubborn. They'll feel like, no, it's just cough, I don't want, it's just cough, I don't want to go to, I don't want to go out. And if, let's even say, okay, the person is now the owner of the house, like, oh, why do I have to leave? So how soon should party A try to move out, probably seek for preventive measures? How soon?
Okay, I would like to say that I understand the fact that some people might feel extremely reluctant or adamant to go to the hospital. Yes, it's possible. But there's one thing that working in the healthcare sector has made me understand is when you make your clients understand, you try to have like a one-on-one conversation with them. Let's be as if you're having an eyeball to eyeball conversation with them where it's only you and them, a conversation that matters. So you make them understand that, oh, maybe it's an aged person or a child or a mother, oh, mommy, daddy, let me make you understand this. This cough you are having, this chest tightness you are having, if you don't get medical treatment, it might get complicated. Make them understand the complications of such disease condition. Make them understand that, okay, if you don't report to the hospital for coughing for a duration, maybe you're coughing for, that you're coughing for a stretch of 1 week, 2 weeks, it's a cause for alarm. It's something to that should even make you like, oh, dad, mom, you need to go to the hospital. So in this kind of situation, it is best for us to sit them down as a healthcare professional and make them understand that there are complications for being reluctant in going to the hospital. If you come with the complications, make them understand that it could affect the lungs, it can affect breathing, it can affect chest tightness. There may be internal bleeding from subsequent coughing. There might be complications that will set in. And when it's setting, reversing it tends to now become more difficult than if it has been treated in the early stage.
So the money that the person would have just spent in the first stage,
The person will now end up spending
Double.
more of it.
Yeah.
So it's just better to treat all these medical conditions at the early stage, where you will not be spending so much money. You can and still be able to tackle the major cause and get the best of the treatment. Than when it gets complicated and you have to spend more than what you had even expected. So it's just best we sit the clients down and make them understand the complications of such diseases condition so that they will at least adhere and go to the hospital.
I think in healthcare that's primary prevention.
Yes, yes, that's
Primary prevention,
prevention.
yes.
You detect early and then. So I have a question. Why do because most these days now people take stress and tiredness for sickness. Some people be like, "Oh, I'm just stressed," or "I'm just tired." It's not malaria. Meanwhile, it could actually be malaria. So how do we even differentiate between those two symptoms from the stress slash tiredness and the actual sickness?
Okay, there's actually a huge difference between stress and sickness. There's some people that respond depending on their body language. There's some people that their body language to stress can actually come down with different symptoms. Yeah, it's possible. However, it is best that we understand our body mechanism first. If party A's body response to stress is maybe having fever, the person already knows that, okay, I respond to stress this way. It's better the person try to deploy a stress management skills. Yes, to be able to undo stress, because we are in Nigeria, so everybody is stressed. We just have to create a stress management skills for individual that works for ourselves, because we are all stressed. As soon as I live in Lagos, you are hustling, you are making money, you are being stressed. So you just have to come up with a better coping mechanism
Yes.
to handle your stress. However, in cases where maybe party A is responding to his stress management, like maybe having recurrent episodes of fever. If you notice that, okay, party A response to stress is fever.
Okay.
So you cannot just say, okay, because I have fever today, then it's all gone. I know I'm stressed. Then what if this fever comes recurrent? It comes like happening like in a week interval, it begins to happen more than 3 episodes in a week. Then it's something that calls for attention. It's something that will be like, oh, am I sure this is not really more than stress? Then in that kind of situation, they might need to start paying attention to visiting the hospital, because I'm sure we might not want to do the over the counter, treatment method as well.
And I also have a question. Okay, why are we always falling sick? We know that our environment plays a very large role in our health status. So I would like you to like list or that will help us understand the places that that are more that carries more infectious diseases and germs that could infect the normal everyday human being easily, and what to do to avoid places like that or to stay safe in those particular places and in our environment. That's my question.
Okay. We you say the more we walk, the more we live, the more we breathe, we are surrounded with germs. But how better can we reduce the spread of these germs? Even people that are predisposed to all these um, germs or environments that are actually highly susceptible to infections are people in overcrowded areas, people where there's no proper drainage systems, people where there's 100% noise pollution. People that live in the market area think, oh, they are living in a safe place. I'm so sorry, but that is a determinant to your health.
Yes. Health is
Yes,
determinant.
it's a huge determinant. Another thing is, imagine living in a place where there is a lot of swamp.
Swamp.
Yeah,
Okay.
Yeah.
there's a lot of swamp. There are gullies that are filled with this green, what they call
Yes.
Yeah.
spiritual or
Yes,
something.
yes.
There's a lot of it there. And you now feel that in your mind, you are
Think
living
it's
healthy.
No way.
It's something that is evident that it's a no. You are not. So when we try to, people that are living in populated areas that are crowded, that are filled of swampy areas, noisy areas, those people, I feel their health is definitely compromised. Not at some point, it is compromised, because the noise is definitely going to affect the mental health. Yes,
Sure.
the swampy areas we inhale, the odor from that swamp,
alone.
yes, alone is going to affect the maybe poor drainage system. When those dirt accumulate in a place, it breeds all these germs, flies,
Germs and definitely
this,
we inhale
yes,
it.
and this thing end up bringing out all these odors. We inhale them. So all these people living in crowded areas, places that have poor drainage systems, noisy areas, these people at some point have their health compromised. So it's better in the sense that if a proper drainage system is put in place, where dirt don't end up packing in a lodge, where in a spot where all the it tends to breed flies and all the lines, and crowded areas, there are better ways we can do better in ensuring that I'm not saying we should not go to market, because they say when you go to market or noisy areas, or even you just passing your road alone, the noise alone is part of it. But there are ways we can curtail this. There are ways. And the ways we can actually curtail this is that we try to give time ourselves. I'm only going to spend 20 minutes there for the sake of my mental health. And after I'm done, I'm off. How to reduce overcrowdedness is in the sense that I know that we everybody's trying to survive in the city of Nigeria, depending on where you find yourself. However, there are places we can try to mitigate all this overcrowdedness, in the sense that you might just try to create like a personal space for yourself, where you know that There are people that they have a personal space where this space feels like my heaven. It could be your room, it could be your sitting room, but it feels like your mini heaven. Even though you cannot have all the luxury, bigger space, but the little space you have, you can make it your safe heaven. So that place, you now feel relaxed. You feel even at home. You feel mentally stable, and at the same time, it doesn't affect or compromise your health. The only best way as well we can try to mitigate all these swampy areas is seeing representative, because that's the best way. Yes, government representatives to do it better, because I'm very sure that we as a person will not want to go and be packing those swamps. So if government representative can come together and assist the public or the masses in helping to reduce, these swampy areas, doing proper drainage system, people health will not be compromised. So that's the way I feel other people people can help to reduce, this recurrent rate of illness, due to overcrowdedness, swampy areas or noisy areas. These are the ways I feel that will help.
Thank you.
Okay, so talking about spreading of germs, how does hand washing, how important is it? Because I know that we've been preaching hand washing, and I know during COVID people were religious about it. But now you just see, oh, even in the hospitals now, some people just, some nurses from, or let me just put it as a, medical professionals, they'll just leave this patient, and so we are not religious with that particular thing, hand washing. So how important is it when it comes to spreading of germs?
Yeah. Okay, hand washing, as people now, hand washing is a poem, and it was more of a song during the COVID era. But now it seems as if it's trying to die down. However, hand washing is still there. But most of us are not incorporating it the way we are supposed to do. In the sense that I will tell you for a fact that hand washing plays a major role in even our individual health. Before you put that thing in your mouth, you don't know that fruit you want to eat, you don't even know if it has gone to so many places, processes it has gone through before you even purchased it. That water you are even drinking, you don't know the processes it has gone through, the stage it has gone through before you reach you, the final consumer. So that's why, and you might not know, you might just be touching the bottle, you might just be touching the item, you might just be touching it, you don't know the process it has gone through before it even gets to your point. And the fact that it might have gone through a lot of processing, jams process, you won't know, you will just like grab it, and you will not know, oh, my hand is still clean, or maybe I just cleaned my hands, washed it the previous minute, you now feel okay, it's still clean, but you just touched something. So the fact that you just touch something that has gone through so many processes before it goes to you, the final consumer, you now feel in your mind that it is clean. Oh my God. You know that you're also inviting that germs into your own body. And the fact, another thing is, let me say a beautiful thing. I would say it's beautiful. The fact that we have surface area surrounding us makes us susceptible to germs. As long as you have surface areas as minute as anything. I don't want to mention the surface areas, but as minute as anything, harbors germs. Yes, the invisible microorganisms we see is a good evidence for us to know that when we even touch anything, it is required for us to even clean our hands. It's very important. Washing hands before eating, washing hands after eating. In the surgical room, they will tell you they have procedures where you have to wash your hand. Before you even touch anything, you have to wash your hand. Before you touch your patient, you have to wash your hand. During the process, you have to wash your hand. After the process, that's how hand washing is very important. Because those things, you cannot afford to introduce germs into a patient. So that's why hand washing is very important. So now imagine we as an individual, they are even practicing surgical hand washing processes as strict as that. How much more we individual thinking that, okay, I washed my hand 1 minute ago and feel like the other minute is not it's clean. It's not. Because even during the process of surgical operations, you have to still maintain sterility of the field.
So, I know washing of hands cannot be overemphasized, but from the non medical perspective, how do we make them incorporate this washing of hands? Because I know most of them feel it's like we are doing too much. Actually, they feel like, I just washed ten. I just watch. In fact, some will say I watched in the morning. Like they feel it's like a once in a day something. So how do we make them understand that this is like it washing of hands is like it serves like as like a 80% hygiene parts of your daily life.
Activity. Yeah,
Yes.
washing hands is a very important thing that needs to be incorporated in our day to day, like every minute thing. It shouldn't be like it shouldn't be as if let people say you're even obsessed about washing your
Washing.
hands. It's better that they know that oh you have obsessive compulsive disorder in washing hands than
Not
you are
doing
not
it.
washing hand. And we can there are better ways you can do it better because one thing is if people in rural areas don't get this information, another thing is their health is compromised as well because they are indirectly also introducing these germs into their body unknowingly because they are not aware of this initiative or this knowledge of washing hands. However, health education can play a major role in helping people in the rural area understand the basics of hand washing and how it's important. If we want to go to rural area where they speak Yoruba, you we delegate people that can speak Yoruba very well to go into these communities and make them understand how important washing hand is and how it plays a major role. So do you know that if we even do hand washing process every day and every time, we will at some point reduce the way we have illness. Like
Honestly.
because when you're introducing germs into your body, you're making yourself susceptible to all those infectious diseases. But when you practice this hand washing process method very well, you try to limit the rate at which you get susceptible or exposed to this infection diseases condition. So if it's best, community outreaches or going to rural areas to make them understand that hand washing, I don't know how they say it in different dialect, but people that are quite conversant in the best way to communicate to those people can do it better to help us in sensitizing these people because hand washing plays a huge part. As minute as it is, as it looks like, oh, it's not something it is really serious. It's really serious because even the clothes you are wearing, you don't know the microorganisms that face on it, that feast on it, and you are touching it. Of course, you don't know. And the next thing is, oh, you are putting your hand on one fruit like this, and before you know, inside your mouth without washing the hand that has been exposed to that germ. That's how important as important as minute as it is very it plays a key role in preventing the infection disease, we acquiring infectious disease condition or any form of disease condition. Yes.
Okay, from the looking at from the non-medical perspective also, I believe sanitizer can play that particular role because we can't be washing our hands every time when we're outside. Sometimes, so I believe recommending sanitizers is still a very important plays a very important role also. Yeah, because I remember back then I used to have one very small bottle with sanitizer. I'm also guilty of this particular crime. I don't wash my hands anymore. But I used to have this very small bottle of sanitizer that I press on my hands every five minutes or every 10 minutes. I mean, it was actually becoming an obsession back then. So I had to just like stop it and all of that. But then now I don't even do it anymore. But so I'm thinking sanitizers also should play that particular and also limits
And
can also suffice for the role of washing the hands every minute like that because we won't be available water won't be available to us every time. So I'm I'm asking if that can take the role
Yeah, it
of
can
water.
take the whole but for how long do you want to sanitize your hand? When you sanitize your hand, you know that it has its own odor, it has one
Yes.
scent as well.
Yeah.
And some people also respond to scents
Mm.
that are quite harsh.
Yes.
Some people that respond to scents that are harsh. So now, okay, you feel okay, you sanitize your hand. The thing is, there's this method that they say, okay, when you sanitize your hand 2 times, then you wash. After you sanitize your hand 2 times,
So
the
sanitize.
next one you
I'm
wash.
hearing that for the
Sanitizing
first
alone
time. I'm
is
hearing
Yes.
not
that for the
enough.
first time.
Sanitizing alone is
It's
not
not
enough.
enough.
That's what
Actually.
you know. Because even the sanitizer alone, it is made of items, it's made of things.
Yes.
It's made of things as well. Just the same way people respond to sanitizer and scent. There's some people that don't use sanitizer because of the
Yeah,
scent, because it
that's
contains
nice.
ethanol.
Yes.
And some people are actually hypersensitive to ethanol. So what are you going to do in that kind of situation?
To wash your
You
hands.
wash your
Make
hands.
it
So
easy.
hand washing still beats the game in everything. Or however, if you notice that you are not, sensitive to ethanol, do the two sanitizing. When you after you sanitize twice, then you wash.
Interesting.
Yes. Wash and try to wash before putting that spoon, even that spoon in your mouth.
Because I feel even using sanitizer,
Mm.
as you said, it contains a lot of.
Yes, a lot
So
of things.
imagine I want to
Substances.
eat, and okay, for instance, I want to eat swallow, then I use
You now use
sanitizer,
sanitizer.
So,
then with my mouth.
It's your
So
exactly.
That makes
So
sense.
yeah,
nothing beats washing of
nothing
hands.
beats above all the washing of hands covers and overrides everything. Yes.
So in short, washing of hands is like the center of like
And daily life.
preventing
Yes, yes,
diseases.
yes, yes, yes.
Interesting.
okay, so going back, you mentioned something about over the counter, yeah?
Yeah.
So please, can you just put us through how it can affect our health, basically?
Okay. I'll give a okay. I wanted to say I'll give a scenario of a client that I lost. This client, why over? I wanted to advise people if you can do more health campaign to discourage over-the-counter medication because this is causing more damage than good. I had a client that came into the hospital on blessed day. I was on duty that very particular day, and this client came in with blisters all around the body due to the use of a particular over-the-counter medication. We feel that okay, over the counter, I could just rush to the nearby pharmacy or rush to the nearby and get any medication that I want. We don't even know if it is what is good for the illness.
Exactly.
We don't even know if the content used in making the medication is ideal for us. But we just feel okay. They said I should go and take this. Let me go to the pharmacy and get it. And the funniest thing is we can't get all these prescriptions from people that are not they are not qualified.
Yes.
And we now assume you just go over there, over the counter, get the medication and take it. This guy was responsive to sulfur. He never knew that he was responsive to sulfur. He got the prescription. After getting the prescription, he was taking the medication religiously. Like, okay, this is the prescription for this medication. So if the blister started coming, he felt that, oh wow, beautiful, this medication is working. He continued. Not knowing he was responding negatively to that medication,
My
unknown to him that his body doesn't accommodate sulfur.
So
These are the damages that over the counter medication tend to have. At the end of the day, we end up realizing that this patient had blisters all over the body. And in the mind, in his own mind, he felt that okay, this
Drug
medication was working.
working.
So these are the things that over-the-counter medications tends to do that we don't know. So even before you even prescribe medication for somebody, you ask them, are you responsive to NSAIDs? Are you responsive to sulfur? These are questions that you even need to ask before you just go and say, okay, go and get this medication. Yes, even in the medical field, they'll ask you, do you respond to NSAID? Do you respond? Are you respond? Do you react to this medication? Do you react? There's a patient that react to penicillin.
Yes.
You will not do any major. The risk you could do is go and prescribe penicillin for them.
Lines of GCSP.
Yes.
Deficient.
Yes, you will not go and do that. You can a patient that knows that is reacting to sulfur will even tell you by himself, I don't want, because he knows the effect of it if he takes that sulfur. So this patient at the end of the day will realize that we did a thorough full body dressing for this client because of over the counter medication.
Probably 200 naira or
Yes.
500 naira.
So yes, so and he spent, the amount he spent trying to recover from this over the counter medication damage. So these are things that happen when patients go to over the counter. So even in the medical field, we ask thorough questions like, okay, let us be sure before we prescribe. So that's it. But over the counter, they'll just say like, okay, let me quickly go to the pharmacy in the back of my house and get it. Not knowing the damages that it does. So over the counter medications prescriptions should totally, be shouldn't stop if possible. And if you're getting prescription, you make sure you're getting a prescription from a qualified medical practitioner that knows the do's and don'ts of medication before giving it to you. And when even a medical practitioner is giving you this prescription, you make the medical professional know what you are responsive to, what you react. There's some people, they'll tell you, oh doctor, please don't, I don't react to amoxicillin and metronidazole. They will tell you, this is what works for me. If it's fine, yeah, good.
Sorry, but on the other hand, there are some people like the medical personnel. They might feel the person is doing too much. Maybe the person is trying to say, I respond to this
Mm-hmm.
particular drug, and they'll be like, because I've had situation where I go to hospitals, or let me say a lab, and tell them, okay, please, I don't want my blood sample to be taken from here, it's usually painful, and they'll be like, no, this is the only place they can get vein from, and meanwhile I can see
Your
my
vein, and
vein
you know
here.
where your vein is
Yes,
better, you
so some
prominent
people, they
enough.
don't listen. Most
Okay.
of them, they don't listen. Let me not say all. Some
Okay.
of them don't listen. So what, how can we,
Okay.
how can we handle that
I usually,
situation?
there's something I usually tell my patient anytime I see them. When somebody even comes to me and like, oh, they gave me this medication in the hospital and they didn't write the name. Why are you not writing the name? You have the right to
To
know
ask,
it.
yes.
It's your right. For goodness sake, it's your right to know the medication you are
Yeah,
being
taking.
dispensed. Imagine they are dispensing a medication that asks for it, written packed in an envelope. You don't know, they are giving it to you. So you have the right to know. What if it's a medication that has penicillin? What will you do? They didn't write the name of the medication. You went ahead and take it. You have the right to know. Once I even tell this, you can never get any of my vein here. Don't. The thing is, don't even pinch
As
me more than
usual,
once.
they don't listen. They'll
Don't pinch
tell
me more
you,
than
are you
once.
you're trying to teach me
Yes,
my work?
it's understand.
Yes.
Some people do that, but I feel it's your right as a patient. It's your right. Your right to know the medication you are being given. Your right to. There's some patient. There's a hospital. They have gone to the hospital and they'll tell me, there's a particular medication that works for my own allergies. And I told in the hospital that if you give me any other medication, it will not work. This particular medication is what I know works for my body. It was after so much. Yes, the practitioner actually felt that, oh no, this one will do better. I said, sir, you don't know my body more than I do. You don't know it better than I do. If you feel it's difficult, just tell me you can't prescribe. Let me get it outside. But this is what I know works for me. So you have the right to hold this thing. But the one thing is, most of the time, most patients come and make you feel like, doctor, I have the right to tell you what to do without putting the four words of your courtesy.
Yes, the approach.
Yes, the approach matters. You can tell the doctor, okay, doctor, or any of your physician, this is what I know has been working well for me. But you can't just come and like, oh, make them understand, infringe your rights and make them feel like, oh, because you have the rights or whatsoever, you feel you can talk to them anyhow. Oh no, nobody will give you the attention. You have to just calm down and say what you want to say politely. Yes.
Okay, does that mean we have to question everything the doctor tells
No,
us?
you don't have to question. You don't have to question. What I'm trying to say is that you have the right to know the medication you have been given to in the hospital. Yes. People that are responsive to certain medications today, as a result of those prescriptions they put in the drug envelope, just count it and put it inside. Once they count it and put it inside, the name is not there. And you go home and take it, not knowing that that medication you have been dispensed in the drug envelope, you react to it.
Okay, how do you know you react to a particular drug? For example, people that are not even in the healthcare system,
You
they
have
don't.
you
How do
have
they
to
know?
yeah, you have to go to the lab and get it tested.
Yeah.
That's how to get it better.
Oh my God. Because I'm concerned about those that, for example, old people, like people that are not very educated. How do they find out that, okay, this thing does not work for me? And for example, okay, things like headaches, simple headache, and maybe stomach aches. Do we have to go to the hospital for that before we
No.
can get? Because when you mentioned something about over the counter stuff, so do we have to go to the hospital for things like headaches and stomach aches or little things like that before we can get a medicine?
Headache. One thing about headache is headache is a symptoms.
Mm-hmm.
Stomach ache is a
The
symptoms.
symptoms, yeah.
So there's headache, that means there's something
Mm-hmm.
happening in your body.
Mm-hmm.
You might try to say, okay, everybody knows paracetamol cures headache. Okay, you take paracetamol. But then this paracetamol ends up becoming persistent. Second day, there's headache. Third day, there's headache. You say, okay, paracetamol will do the magic. Some people even go as far. Let me go to my backyard, pluck some leaf, cook them, and it will cure my headache. Yes. But now, once a headache becomes persistent beyond 2 occasions, it's something you need to pay attention to. I just tell people that headache is a sign. It's a sign and symptom that something is wrong with your body. Stomach ache that lasts beyond even 2 days, 2 episodes, is a sign that something is going on in your body. And it's something that you need to pay attention to. Yes. It's not something you should keep quiet with. Somebody that is purging for 3 days, 3 days, feels okay. My body is formatting the worms.
Waste product. Waste product.
Yes, say my body is vomiting and formatting is washing away the waste products, cleansing.
Detoxification.
Whereas that person indirectly is
Maybe
being
food poisoning.
yes, food poisoning, and because the person is having diarrhea, there's possibility that the person is also running into dehydration.
Of course, lots of water.
Yes, and the person will be like, okay, my body is formatting all the jams, so you continue doing your in backyard, all those, and feel like it's doing it better. No, all these things are things that end up putting people to complications that are beyond repair. So when we notice signs and symptoms of headache lasting beyond 2 days, stomach discomfort lasting beyond 2 days, these are things we need to pay attention to. It could be food poisoning, yes, it could be, and so it's something to pay attention to.
So, talking about some food now, what we eat, basically, how does it affect our health?
Yeah. Okay, what we eat has a determinant to how we function in a day. What we eat is a huge determinant. Now, I won't say people, we feel we are eating properly when we take a lot of carbs. We feel we are eating, my own is let me just quench the hunger pants and I'm eating. But there's one thing, after research and thorough studies, I realized that eating foods that is like made of plant diet and wholemeal plays a major role, in our health, in our vitality. Let me use the word. If you eat food that is not balanced, I know they say economy might make you not to eat balanced diet, but to some extent we can incorporate the vitamins into our meal. It plays a major role. Even if you are eating carbohydrates, carbs so lot, what of vitamins? Like we can do better with that. Some people don't even get closer to proteins. They feel okay, even the beans, the fish, there is a taboo for them. So how do you balance it?
I have vegetables everywhere.
And there's vegetable, there are fruits. So why not use that to supplement? You don't eat fruits, you don't eat proteins, you don't eat veggies, you only eat carbs. So what are we balancing? Then tomorrow we now ask that we're having deficiencies in one thing or the other and one thing or the other. These are things that need to be balanced. Yes. If you are getting a lot of carbs, you can incorporate a snack meal into your diet, incorporate a fruit meal into your diet. Like make it a routine, make it a ritual. You know that ritual when you know that okay, I hold myself a duty of eating a watermelon a day. I hold myself the duty of eating even if it's cherry a day. I hold myself the duty of eating vegetables a day. It helps. When you even do you know when you eat a lot of carbs, you end up realizing that it end up have it builds fat, it causes you're prone to indigestion, you're prone to yes, you're prone to a lot of issues around surrounding constipation. Because what is diffusing you? What is going to dissolve your tummy? What is the mechanism that you're going to use to help you to dissolve that
Digestion.
yes, to dissolve that carbohydrate? So when you bring in those vitamins, it helps your metabolism and your gut health in the center. You now feel very easy to even visit the restroom, the convenience. It's not something that you now have to be battling with constipation for a long time. Because eating a lot of carbs causes constipation. It delays metabolism rate. You find it difficult to even go to toilet.
Okay, so I still need some closure regarding the question I asked the other time. So, if, for instance, the person has headache, and then are we saying that the person, an individual can go to the counter and get paracetamol and use, but only when the symptoms persist after 2 days or after 3 days? That's when the person is supposed to go to the hospital. But what's the range? How many? What's the amount of days that the person is supposed to use to monitor the symptoms if they still persist, but the person proceeds to go to the hospital?
Okay, that's what I'm saying. That paracetamol is something that's why we have pharmacies. Yes, that's why we have pharmacies. You have headache, they dispense pharmacy, they dispense the paracetamol. Yes, but after dispensing the paracetamol, That's why we have pharmacy in our nearby surroundings so that it make it easier for us to get those
Access.
medications. But if your headache is lasting beyond 2 days, you know that there's a lot of people that know that they have this headache, it's really that persistent. But they just feel, let me take the paracetamol for as long as when it stops. But there's something really happening. They feel, and one thing about it is that people use paracetamol to suppress their illness. They don't know something is buckling inside. They use paracetamol, any small thing, can't take paracetamol. Any small thing, can't take paracetamol. They feel paracetamol is just one that and they feel one thing about it I've realized in my years of experience is they feel paracetamol does the magic to all medical
Everything.
conditions.
Mm-hmm.
They feel once I take paracetamol, it will deal. Do you know that headache is a sign that there's something different, something beyond that headache. There's something beyond that headache. The headache is just a symptoms of that it's just a sign that there's an illness inside. That's just the thing. That's just the realistic truth. So when you're taking paracetamol, you're only quenching the symptoms. You're not dealing with the medical condition that is triggering that headache. So that's just it. You're not dealing with the condition that is triggering the headache. You're only dealing with the symptoms, the presenting signs. That's all you're just dealing with. Why the symptoms, why the illness is still there, waiting for you that okay, when you are done taking my paracetamol, you will give me my attention.
So in summary, are we saying that whenever we have a slight headache, we have to go to the hospital straight?
No, when you, that's what I'm saying that when you have all those illness, I have headache, yes, you can get paracetamol, yes, but however, don't we should not abuse paracetamol in the sense that after 2 days, when we notice that headache is persistent for beyond 2 days, visit the hospital. Yes,
So 2 days is the
yes,
fine.
it's something.
That's
Yes, it's something.
serious.
Yes, that's serious.
So, okay. There was this video I saw. She kept on having headaches, not knowing it was a brain tumor.
Sure, you see,
So serious.
exactly. Even some people tell you, even a day, like, but it's just that a day they'll just tell you that okay, let's see, observe. No, let's see, fine. But beyond 2 days, beyond 48 hours, please visit the hospital. It's very important because a lot of things happen. Some people it might be infection they are responsive to, they're just taking paracetamol. So it might be malaria, they're just taking paracetamol. It may be something beyond brain, even beyond brain tumor, they're just taking paracetamol. Paracetamol does not deal with the medical condition. It's only helping you to reduce the symptoms. Not need to suppressing it. So that's just it.
Paracetamol has seen a lot in this Nigeria.
I'm telling you,
And
people
So-
have used it a lot.
affects another thing.
Yeah.
Yes.
The liver.
So yeah, when we are sick here, we believe that our body there's something our body is fighting inside here.
Yeah.
It's more so that will bring me to immunity. So talking about immunity, what can you tell us about it? Our body immune system.
Okay. We as an individual, as a whole, we had a huge duty to play in protecting our immune system. Because there's one thing that is, if your immune system is compromised or there's anything as such as immunodeficiency, you as an individual, you are susceptible to infection. You're susceptible to it. And immunodeficiency happens when your body cannot fight infection any longer. And all these things, there are a huge lot of determinants to why people have experienced immunodeficiencies situations. There's some people that, due to some medical condition they had in the past, immunodeficiency sometimes is inevitable. Poor dieting, inability to handle stress, poor sleep timing. Some people feel okay. Let me just go to bed and sleep. You think you are not getting adequate sleep. Your immune system is getting compromised. You're not getting enough vitamins that is required of you to function daily. You're compromising your immune system. You understand? Not practicing proper hygiene. Because one thing is, like I said, hygiene, that's the same way we're talking about hand washing. Hygiene plays a huge determinant to our immune system, our health. So if you end up realizing that, okay, you're not doing your hygiene properly, you end up realizing that you'll be having infection because you're not practicing clean hygiene system. You'll be having infection every blessed time. And you're already compromising your immune system. Your immune system will now find it very difficult to fight delicate infections. But which, as we had practiced thorough hygiene processes, hand washing, some people even I will tell you that even the spoon we used to eat, the sponge we used to bath,
Yes.
the sponge we used to wash our plates deserve the hygiene.
Yes.
Our phone pouch
Yes.
deserve the hygiene.
Yes.
But people don't know this.
Like little
All those
things.
little things is a huge determinant. And before you know, and this is it, the sponge you're using to bath, as much as you use to bath, you feel it is clean. After bathing, you use water, you feel it is clean. But people fail to realize that you see that your sponge you're using to bath and that sponge you're using to wash your dishes, you deserve to give it a special treatment. You know the kind of treatment soaking inside hot water.
Yeah.
Hot water. That you know your bathing sponge, when you soak inside hot water and when you soak it and cover it for a whole full day, let this heat deal with this virus there, with these germs. Soak it with like maybe like an antiseptic or something. Give it its own special. That's a special
Use
treatment.
sponge for 1 year. Like serious, use sponge for 1 year. Okay.
2 years.
Yes, don't change it.
I tell somebody that
Thank you.
as my phone is like that, I do sanitizing period for my phone pouch.
Washing. I wash
Yes,
mine.
I take it like this. I take like methylated spirit.
Yes.
I soak my cotton. I soak it inside my cotton wool or my face pad. Face.
Yeah.
I clean the body. You will not come and implicate me.
I feel very attacked.
Dangerous. You do it.
You clean it.
Ah.
See, some people only
I wash mine with
some
soap.
people only remember to clean your phone when you want to take pictures. No, you just can't clean your lens. No, that your phone. As you're taking it, you're dropping it here. There's a jams on that table.
My phone harbors a lot.
It abhors a lot.
I think people would. Okay.
The sponge I use to wash your plate. If you, okay, after I wash it, just do it like this. People just feel like that shaking it means
The
Germs are free.
germs are free. But that sponge, soak it inside hot water. Even if you don't even use antiseptic for the kitchen one, at least inside hot water. Yes, it helps. Then we know that when you're washing plates very well, clean.
Yes.
So hygiene is a huge lot of determinant. It plays a huge role, a very huge role in how we live in our daily living. Yes.
I think if people can have access to this microscope of a thing and you
Yeah,
now place
see,
your
yes,
sponge and you are seeing the germs that are
They
there.
wouldn't believe.
Yes.
That.
I don't even want to see it. Because of the
Yes, if people see have microscope and they're able to see the rate at which germs is present on
Yeah,
our
maybe
so
surface,
they
they
will
will take hygiene
take it
important.
I don't think I want to see that.
So and now imagine how somebody will now say, okay, I wear my clothes more than 2 days. What are you doing? What are you doing?
Because,
You go every day from one place to the other. The
You know how
microorganisms
many
are pitched
people-
on your clothes. You take it, you add it to your wardrobe. Well, yes, contaminate the other ones. You don't even have a special place where you keep all these ones you've used. You just put it back. No, this thing, let me tell you, this thing plays a huge determinant. Then we come and ask ourselves, oh, why am I having skin reaction? What is this rashes coming from? Kitulele, bye. You be asking yourself, what is this?
Yes,
No,
of course.
you don't know that.
Those little
Yes, those little to play a huge determinant. Your clothes has helped you to carry it from the unknown source and giving it to you. You now be asking, where is it coming from? So, like I said, and this is, if we don't pay attention to this hygiene, of course, immunodeficiency begins to fall into it because we now realize that we have become more, infection every time. You go to the hospital to treat. Immunodeficiency, and yes, we are not ready to eat balanced diet to even balance the equation.
Exactly.
So talking about the balanced diet now, this is Nigeria, and with what is going on, um, let me just put it as poverty kind of. So for people in that condition or the middle class family, what would you advise? How would you advise them to? Let's say there's some people that will tell you, I'm buying this because I have 1,000 naira. I want to prepare rice because I have 1,000 naira, right? But that 1,000 naira, you can actually buy a lot from it. Not a lot like that, but you can still get fruits, fibers, and the like. So what's with 1,000, 2,000? How do you think we can manage to get a balanced diet? Not balanced
Okay,
diet, but
okay.
balanced.
Okay, they say in every little you can still carve out the mighty of it. That's the thing. So now you have 2,000 naira you want to use to cook. You can actually even get pineapple of 200 naira. You can get it. You can, even if it's aboki can you give me 100 naira orange?
Yes,
He will give you, even if it's one.
Yeah.
You have to take at least.
Yes,
at
at least at all, you can even get, now you can even get cherry. You can even get cherry 200 naira. 200 naira. You will eat your cherry, drink water on top, and you will be better. You even forget that you need rice. And that's fruit. That's vitamin. You can. There's some days that I just make it a duty. I just want to eat fruit. This day allocated to fruit, you get a lot of cucumbers. Merge it with your granules. Sit yourself on the high seat of the tables. Eat your cucumbers. That's a huge meal. That's why you eat cucumber, you will be belleful.
Yes.
For people
There's
that don't
what
like,
I know.
for me, I don't like cucumber.
And there are other
No,
fruits.
you get another food that you most
Yes,
like.
like-
Even if it's watermelon,
Yes.
get it. Sit down. Give yourself say today. Oh, that vitamins I've been depriving myself for. I'm getting it today.
Just as if you want to
Yes. I used to tell people that make it a ritual. Just do it like, even if it's pineapple you love.
Take it.
Sit down. Say today, this pineapple is me and you today. I'll finish you. There are vitamins you'll be depriving yourself for. Get it for yourself. And if you can at least extend the hands of care to people who you know that they don't have opportunity of getting this food, do well to extend it. So like it will help them. They will even think, thank you. Even if they don't know the importance of it, just
But
give
you have
them.
done your
But you've
best.
done your best.
I think, okay, I don't want us to stop, honestly, because I mean, this is actually very
Interesting one.
DM. So, faith and praise. Can you conclude? Do you have any other conclusion?
No, I think we should clap for her. That's what I was going to
Yes.
say. But she answered everything perfectly.
Thank you.
Yeah.
Thank
The
you.
questions I have, she has already answered. So
Thank you.
Same here, yes, because I have some questions that we have asked,
I
but
have-
while my fellow co-host was asking, and I think you also that's contributed to the
Yeah.
questions.
So she did 100 over 100.
Thank you so
Yes.
much.
Thank you.
101.
Thank
Thank
you.
you. It's
Thank
nice
you.
having you
Yeah,
here.
nice having you too.
I mean, I enjoy. There's this particular thing I just hearing for the first time. Actually, this sanitize your hands twice.
Well,
I had
Because
like
I don't even advise people to
three
use
new
sanitizer.
things.
I was
I
just
had
like,
like
what's
three new things
sanitizer
today.
for? Please, sorry, I don't want. I
I
don't
know
want
people
it.
sanitize, but I didn't
But
know you have to
you have to-
sanitize twice.
Yeah, I
Twice.
don't even
Wash
advise.
your
I'll just be
hands.
like, you know what? See, wash your hands is
That's
enough.
the
The best.
But so now going back to this last one, going back to it, if we can you take us? I know that there's this minute, this particular minute, there's a way you wash your hands here. So can you just put us through? Okay. And some people that will go to. Okay, I think I went somewhere recently, more like a food canteen, a local food canteen, and instead of them to give us a what's it called, a normal tap, a running tap water, you had to you have to take water from a bucket, wash, and
And the
the bowl itself is
Dirty.
infected. It has so please can you put us through how the process, then how the normal way to do it, if it is tap water or rain water. If you can just-
Okay, yeah, you are right, because everybody has opportunity of getting themselves a running tap.
Yes.
But if you have opportunities of getting yourself a running tap, then do it well in a running tap. A running water, a running station that accommodates a proper hand washing. Because when you are washing, you have to do the interlocks very well. Some people want to wash their hand and feel like, okay, when I'm done, this is how, and that's all. But something is there. Something is there. Yes. Something is living inside there you cannot see.
Eh?
Something is living in between your nail beds that you cannot see. So these are things, and your palm is also there. It's not just all about it. It's not about scrubbing. If giving yourself, it's just like today. Anytime I'm washing my hand, I'm giving my hand a nice treat. I say that. Say it's a treat so that you will know the importance. But if you just say it's hand washing, you just. Or say to yourself that today I'm giving my hand a special treat. So that when you are doing it, you do it properly. Interlocks in between your nail beds, scrub your palm, scrub it properly. If you have the opportunity where you get a running tap, do it well in a running tap. Because if you are going to the canteen and expecting them to give you a running tap,
It's not
Well,
perfect.
yeah.
That's so. The thing is, we'll be doing two fair to do it, and praise to do his own tomorrow. Lots
Let
of
us do
time.
two, yeah.
Let's just do two.
So
So should we start? Should we
Just
put?
do a conclusion.
Oh yeah.
Yes, the
Okay.
conclusion.
So one more
Can do
thing.
praises
So
zone now.
one more.
It's up to now.
Oh yeah, let's start. Have we started? One more thing, please. Teach us how to wash our hands. We also want to learn it.
Okay.
Just teach us now. Let us practice it.
You know there's no running tap here.
Doesn't mean just
There's no running tap
Just
here.
practical.
Because when you put this is a running tap,
Okay.
of course you use your hand to open the tap.
Okay.
When you use your running tap, water is on your hand, you use your hand to press the soap on your palm, then you put it, then you rub,
Okay.
then you, the same way, then you go interlocks,
Okay.
then
Fingers.
yes, your fingers, yes. When you wash your palm, then you wash interlocks in between your fingers because you're in between your fingers, your fingers are more dense as well.
Yes.
Yeah, you do it as well. Then there's how you scrub it. Then you now scrub it very well. Then after that you rinse. When you rinse it, when you're done rinsing it, they should say that you don't use that same hand to close the tap.
Yes.
Yes, you can use your
Yeah,
elbow
exactly.
to close the tap.
When you want to open
Yes.
a door or something,
Yes,
you
you can use your elbow to do
So now
that.
you're saying it's more like your soap, your water, then you press your soap.
Yes, you press
Then
then
you go like this.
yes, you wash.
You go like
Go like
this.
this,
You go
interlock.
like this. You
Scrub
go
your
like
palm.
this. You go like
Yes.
this. You go like this,
Yes.
right? Then you go like this,
Yes.
and wash.
Then wash your
Then
hand.
you don't
You don't close it. Yeah, you
do
don't. Yes,
like this.
yeah, elbow.
But what
It's more
about
like-
taps that you have to,
Turn.
Turn
to
and
turn?
Then when you have tabs, you are sure when you have tabs that you do it. Okay, there's how you used to do it. There's not how you have tabs it's not all the tabs that you can use that for.
Yeah.
The ones that you have to turn, there's how you do when you're done washing your hand. There's how you use one hand to carry water.
Water. Yes.
Use one hand to carry water, then you cover it. Then yes, that's how to do it.
I love
So
it.
that's basically it.
So,
Yeah.
thank you so much. We are so glad to to have you here, and we don't mind the second time. But for me, it's really a very interesting one. I can't say. I can't.
Oh, yeah.
Yeah,
It's
yeah.
an eye opener.
So there's this treat we have for our guests. It's a special book diary. It's from the USO. So our guest signs and you get your autograph on it, and yeah. So this is it. Should I open it? So it's from open my phone. So this is it.
Okay.
So for each page, this is what you write. The
Okay.
episode, this is episode 1. Your name, your date, your profession, topic, comment, and your autograph. I mean, that's a privilege to have your
Which one is the autograph? I'm trying to understand that part.
signature, kind of.
Okay, the episode. So what's
One.
okay? Episode 1. My name. I don't feel like you know my name.
Okay. So thank you.
Thank you.
Thank you so much.
So on behalf of Inside Healthcare Podcast, I want to give you this token
Same thing.
of appreciation.
Okay.
For a job
you.
well done.
Thank you.
Thank you.
Very
Thank
well.
you. Thank you.
Very well.
Thank you.
Thank you. So
So-
this is the end of this episode, and my name still remains Sims.
Wow.
Eniola.
praise.
And this is Inside Healthcare Podcast, where every
every
voice matters. So at the end of this, so if there's one thing you should go with is healthcare work best when system listens to people. See you in our next episode. This same time. Bye.